Hi, Sue. Good to see you.
Hello. Hey, folks. I'm going to maybe give us a minute to see if other folks join us. I apologize that I am a substitute for Katie Zeitler, I believe is her name, um, who is currently the manager of the Dementia Friends program. And she is amazing. If you haven't heard about Dementia Friends, if you don't have a Dementia Friends group in your community, you're going to want to find out about it because it's a great way for you to get personally involved. And we can either connect you through your area agency on aging, or I can have Katie connect you with the local coordinators. So really, don't hesitate to ask about that because she was going to tell people about the work that Dementia Friends do. And I can see by the people we have in this group, we have folks who are very involved with services at local AAAs and through local AAAs around dementia services. What I was going to do today to start from a different perspective, and this was what one of our AAA directors recommended, is there's a lot of really good data nowadays. We clearly we need to be focusing our services so that they better support people living with dementia. We need to really continue our work on dementia friendly, being a dementia friendly state and having dementia friendly communities. I mean, we need to continue doing all that for people who are living with dementia, but we also need to recognize and support the research that, okay, I'm sorry, I'm getting a note. I'm going to ignore it. We need to do all we can in dementia reduction, let's say reduction. So there's data, there's statistics. I have a very simple sheet that Katie shared with me as a member of her Dementia Friends State Advisory Group. And I wanted to just start the conversation, just polling the group. I'm looking at the list. So based on what you know, in terms of keeping your brain healthy as you age, what do you think are give me an example of a risk factor that's been identified, something you can do that could reduce your risk of dementia? Anybody?
Physical activity and social connectedness.
Absolutely. Physical activity, social connectedness, definitely.
Sleep.
What else?
A good
Sleep.
night's sleep.
Huh?
A good night's sleep.
Absolutely. Yes. Getting plenty of rest. That's on the list too.
Control the hypertension.
Yes. There you go.
Activities like reading or puzzles, things that expand your neuroreceptors.
Yeah, they identify on this list basically never stop learning. I would put that in that category of never stop learning.
How about hearing loss?
Exactly. It's another one. Monitor hearing and treat any hearing loss right away. That's one. Other ideas?
Good nutrition is very important.
Absolutely. Yes, maintaining a healthy diet to as much as you can for sure. Since we had that whole topic today about the challenges people are having around that.
Actually, Katie sent one out. She sent out a bunch of links. I'm a dementia friend, and one of them had to do with ground lighting, uh, uh, causing being a contributor. People have you can't see the stars at night because people have their porch lights on. That type of ground lighting, and also troubles with vision can lead to dementias. She sends out a monthly newsletter from someplace, and it's got really great links on it. Anyway,
That's great. Well, that's one of the benefits of being a dementia friend, right? You get that information. Any others you want to identify?
Heart health is really important. So that's one of the ways that the medical system is trying to help by keeping blood pressure down.
Absolutely. Keep your heart healthy and manage high blood pressure. That's on the list here. Okay, so we've had never stop learning, monitor your hearing. How about protect your head from brain injuries, which is a fall prevention thing. So I guess the more you can do to protect yourself from falls. We got keep your heart healthy, manage high blood pressure, limit alcohol consumption. I don't like that that one's there, but I guess that's just the reality of life. Attain and maintain a healthy body weight. Quit smoking or vaping or use of any tobacco. Treat and manage depression. Here we already talked about building friendships, staying socially connected, developing and maintaining a physical activity schedule, treating and managing diabetes, reduce exposure to air pollution. So interesting to note that there are things that are under our control in some cases, but not for everybody. If you really think about in some communities, the whole issue of like air pollution. We talk about how certain communities are more affected by some of these risk factors and that there are equity issues involved in that, particularly when we see higher rates in communities of color. So I thought that was an interesting place to start. And I'm sure there's a whole lot more detail and research around it, but it's always good to know what we can be doing for ourselves to protect ourselves. But Michael, I also wanted you, since I don't have Katie with us today, share a little bit about what it's like to be a dementia friend in your community.
right now it's I haven't given my first presentation yet. Uh, we're a small community and things go kind of slow here, but what I have been doing is papering the place with rack cards and flyers. I took rack cards to the provider for Meals on Wheels distribution here and asked them to put a card in each of the packages going out. Also food boxes. I'm going to be addressing a meeting of a council of churches just to let the pastors know that I'm here and make a joint request to put rack cards and flyers on their premises. Oh, pardon, my picture's not there. I think I may have the COVID. I'm not feeling up to eat. So anyway, but yeah, those things. I just sent a news release to the newspaper here to announce that we're in town, that it's a worldwide thing, and that now it's available here. But I only actually really started. I signed up 2 years ago, but I didn't start until, I'm trying to think, was it June or something like that? So people are going to start coming in. What I'm doing now that I've got the cards out and the flyers out, and people kind of see the name around and having it in the newspaper. Now I'm going to start going to make person-to-person contact by going to different events. I'm I'm on ALTC, so ALTC tabling events, and help be at their table and find other opportunities for the churches. Each church has that's each church is a different potential in itself. So just finding places, and then I'm sure I'll be I'm sure that next year I'll be rolling in presentations, but right now it's just frustrating because I just want to get my first one over with.
Yeah, and it'll be easy from there, huh?
Well, to me it is, because you have to read, it's an hour of reading, and the main thing is I don't have a problem with that, but I want to see eye contact to see if I'm getting through or not. And some of the members, we had a live presentation of it by Jonica Castro at Yakima on a meeting. And so some of the members of my group have already seen it. So I was going to use them as my first group, but then I won't really get a true reaction from the eye contact because they'll have heard it before. So they could be drifting off. So, it's that's my main thing, is just getting through the first one. But, and it was preparing and getting, going to all the different places and doing the rack cards and flyers and getting the name there before actually trying to get the presentation, so there's some familiarity and legitimacy. I'll shut up now.
Thank you. I see Becca noted that her 17-year-old is working in an assisted living facility and did the Dementia Friend so he could communicate better. That's great. I mean, whatever a person's reason is, whether it's something, in their personal life, experience with dementia in their life, or in this case, a person working with folks with dementia and wanting to be able to relate and communicate better. That's great. So I want to just have this be an open conversation and people share things they've learned, things they want other people to know. I know we have at least a couple of our dementia resource catalyst programs represented from the area agencies. Who wants to lead off with a question or a comment or something they just want to share with the group?
I will.
Great.
So my name is Bethany Chamberlain. I work for Northwest Regional Council in Bellingham, Washington. And we are one of the 3 programs, the Dementia Catalyst programs, are building dementia-capable communities in the state of Washington. We have a staff of 2 and myself as the supervisor. And we're working on a bunch of exciting programs. We're trying to get folks in our community opportunities to build relationships with other people who are living with dementia. We have a strong emphasis on including persons with dementia in decision-making and person-centered care and planning. We started kind of an early stage empowerment group where we did 4 structured sessions and gave them tools that were empowerment based so that they could help choose their care team, learn about end of life, just a variety of things, teaching them about the care hub, or not the care hub, but the brain hub up at UBC and also the memory hub in Seattle. And turns out after we were done, they didn't want to stop meeting. And so we've been meeting for several months, one time a month, and they call each other family members. So our staff is really enjoying that. We are also collaborating with our local Dementia Support Northwest, and we received a grant, and we're going to be opening a spot, or actually Dementia Support Northwest is going to be opening a spot in our local shopping mall. And we're going to be offering services with money that we receive from the Alzheimer's Association. So the goal is to offer respite short-term to help people get into the system, but we also want to utilize the position in the mall to create health programming, health and dementia reduction programming. And so we have a real emphasis on that, not only for people who are currently living with dementia, but also younger folks. So we want to have an intergenerational piece there. So those are some of the exciting things that we're doing up here. Very busy and excited. Yeah, Aruna? I think you're muted.
Yeah. My question was, are there any attempts for early detection of dementia? Because quite often the acceptance, by the person who has some cognitive impairment, they may be aware of it, but they don't want to accept it. And that is leading to, some of the frustrations and such. So is there any efforts toward early detection part?
I can tell you that everybody that works in our program, and actually several people in our agency, are MOCA certified. And so we offer, that's the Montreal Cognitive Assessment. We offer that for people of all ages. So we're trying to normalize brain health. Getting an official diagnosis, as we all know, is not really as easy as you would hope, because the healthcare professionals available to do that have such long waiting lists. And so I think that we're trying to help folks come to terms with that by providing support in the community and activities. We have an improv group that they can drop in on. We have a wild walks through our Whatcom Falls Park, and we're doing some other tours, dementia-friendly tours inside our local museums. Just giving, we're trying to destigmatize dementia so that even if persons, I think the statistic in the state of Washington is 51% of people sense that they have issues with their memory, but they don't get help. And so I think we'll do our best to get them into the doctor's office, but we're also stressing, we know about Dean Ornish's article. We know about the work that he's doing, and why not just eat better and exercise and hang out more in the process until we can get a diagnosis.
So which test are your staff people trained in? You say locus test or
The
MOCA?
So it's
MOCA.
yeah.
Okay. Okay.
And that's not an official diagnostic tool, but it allows people to have a baseline assessment of their memory function. And then we provide a report, and they can share that directly with their physician. And the feedback we've gotten is the physicians are very happy to have that. We've done MOCA screenings where we've gone to health fairs, and our folks have just completed like 10 in one day and helped start the process for the conversations to happen.
Thank you.
You're welcome.
What about some of the other sites for the Dementia Resource Catalyst? What are you guys doing? Laura?
Well, Aruna, I appreciate the comment, and part of destigmatizing the cognitive decline is making services a little bit more visible. We're partnering with an art school and gallery in our region, similar to what goes on with the Fry Museum, but we're going to be working with galleries, and we're going to have art teachers doing art and doing creative expression for those folks who have dementia and Alzheimer's. And then the other thing is we're finding that a lot of our local VFFs, who are the veterans, groups, they've got a number of members who've got higher rates of dementia for men, especially who've been in the military due to TBIs and stuff and the risks associated with that. And so we are developing more adult daycare so that these folks can get support, but get support, especially for men, to be around their colleagues. So, providing support in groups that make sense, that feel that there's that connection, and that part of dementia risk reduction would be having meaningful connections, having purpose. And in particular for men, that's a little bit more of a challenge. So we've got a couple of things brewing now with some of our local VFFs to work with some of the veterans organizations so that we can develop some more of these kind of programs. So we're we're pretty excited about some of this stuff, especially the art stuff too. So some of this stuff we're doing.
Aruna?
Spokane too has group and Dementia Friends. I have had the training, but I haven't done any presentation either. I'm trying to get a few things taken care of. But we have a faith group, where they're connecting with the church communities to see how can the, places of worship could be more dementia friendly. And so that is one area. We also had article written in one of the newsletter that is published by faith organization to kind of stress the importance of this. We also collaborated during COVID to have access to the our local symphony, so that people can access those programs, and then with Whitworth University and their music programs. So that is another area that has been explored more in the area of music, access to that. And also one of our PMC member, and he's also on State Council on Aging, he is working on collaborating with the City Parks Department to have a park which would be, kind of accessible to people with dementia and also their care partners, so they can safely be out and being able to enjoy the nature and beauty and such. Something similar to what is there in Portland, I think. Yeah. So lots of little things are happening. Yeah.
Yeah, so it's exciting that we have right now, the legislature has funded 3 pilot sites for the Dementia Resource Catalyst, and that's Northwest Regional Council. That's Bethany's group. And it is Alt-Q, right? Aruna, it is. So that's the other one out in Eastern Washington. And then the most recent one is Laura Sepoy's up on the Olympic Peninsula. And the big challenge, what we want to do in the future, of course, is expand it to every part of the state. So it'd be through every area agency on aging. We just heard how challenging the budget's going to be. So what we hope we will accomplish this next session is maintaining the 3 we have, because we aren't even assured right now that Laura's going to have ongoing funding until we make that point with the legislature. That was a mistake, I think, in one-time funding. And for those of you who are familiar with the Dementia Action Collaborative, the DAC, that's been in operation for many, many years, that's going to be that's a primary legislative advocacy request that'll come out of the DAC to make sure we have ongoing funding for all 3 programs, which is why we didn't necessarily talk about it today as part of our activity, because it'll go through the DAC. But of course, we will hope that all of you in your role will be advocating to make sure we get that funding. And I see a couple hands up. Stacy?
So I just wanted to talk a little bit about working in partnership with our local health district. So Kitsap County has a pretty active public health entity that we worked in partnership with, and they've launched their chronic disease team with a focus on promoting brain health and working in partnership with us. So doing a lot of messaging in our community around all those protective factors as a public health message. So even when you don't have funds to do maybe a specific pilot project, I know the AAAs are being super creative in how we use our ongoing partnerships, our trusted partnerships with our community partners to really promote healthy aging in general, to combat some of the dementia, or to promote, I guess, just healthy aging in general. But for us, it really is looking at slowing down that prevalence for dementia in our community. So I just wanted to throw that out there too.
Yeah, great. That's a good point, Daisy. Lori Brown?
Yeah, thank you, Kathy. In Southeast Washington, Aging and Long-Term Care, we partnered probably about 6 or 7 years ago to pay for, we contract with the Alzheimer's Association to have a dementia navigator. And so, and we pay for that out of different funds, and we're not a pilot site, but just in 2023, that navigator has been working. So we fund that program, but we've been working with the Richland Library to hold like Game Time Fridays, which is for early stage memory. It's an early stage memory group, and then they've been working with other local libraries to start a book club. We cover 8 counties, so she kind of has a big job in front of her. And then with the Y, she's trying to get some things working with them, and is going to go to the Yakima Humane Society this upcoming year. We hope to maybe start a memory loss like dog walking program, and she has memory cafes going in all of our 8 counties. And then this year, we trained all of our clinical staff in our aging and disability resource centers, our family caregiver, and our Title 19. And we had Dr. Rhodes come in and do an overview, and then we broke the groups apart and did some scenarios so that our clinicians can better address memory loss, and having some of those challenging conversations, and how to work with memory loss. In addition, we have powerful tools and building some of that infrastructure in our 8 county area, and STAR-C, ongoing STAR-C, and then a lot of first responder trainings for people, so that they're recognizing that they might be working with someone who has memory loss, and how to identify that, how to work with them, and then also how to make referrals to some of the support services that are offered through the AAAs, along with then community education, like on brain health. We do have, I think Michael had mentioned, we have Dementia Friends, and Jonica Castro from our office is the Dementia Friends Regional Coordinator. And so we're just trying to develop more Dementia Friends to reduce the stigma around dementia. And so that's kind of what we're doing in Southeast Washington Aging Long-Term Care. And each year we just develop new goals. And I think that's probably typical of the navigators as well. You build upon kind of where you're at.
That's great, Lori. So what I'm also wondering, I mean, we have a lot of different perspectives to come at this topic. I'm going to go ahead, Aruna.
Yeah, I also forgot to mention that we have Memory Cafe at one of the local county library on a regular basis, and also 2 powerful tools of caregiving program through YMCA, also in addition for the family supports. And most of all, our planning director, in collaboration with a group of physicians, had the first responder training that was going to be available to all the first responders online, and they can get the credit for it and such. That was also developed by our former planning director, who was leading the program. So first responder training is available. Please look for it, for recognizing if they are serving people with dementia.
Great. Does anybody else want to share something unique you think that's going on in your community, or something you're involved in that is a model for supporting individuals living with dementia, that whole concept of the dementia friends concept? Just want to make sure everybody gets a chance to do a little sharing about things that you're doing. Eileen?
So one of the things that's offered in Thurston County right now is a Music Mend Minds program through the Senior Services for South Sound Olympia Senior Center. It just is there for people that have any kind of memory issues or even physical issues, and it involves singing for an hour and a half every week, and it's basically music from the early 1900s up through the Beatles and probably the 70s type of music. It's become a really wonderful community, both for people with memory problems and with musicians that really want to reach out to them. So we have some instrumentalists that have dementia, some obviously a lot of the singers, but also for their caregivers, it's just a place to meet and to spend time where everybody is accepted. It's just a really great program. I know they have a couple other music men's minds in the state, but I'm not really sure where they're located.
That's in
Stacy?
the, oops, excuse me. I just wanted to say, I think I read that in the Dementia Friends training manual that singing is a good thing to stave off the dementia. And I just wanted to add stress volunteering. It's always good to volunteer in whatever you're interested in. There's so many different things, the arts, the Nature Conservancy, everybody needs volunteers. And they're usually easy to find in the newspaper where they're looking for them. That's how I got here.
Yeah. Cool. Stacy?
Yeah, so I would be remiss if I did not mention in November, designated as Caregiver Month, the AAAs really do a lot of workshops and outreach to our communities. And in Kitsap County, we're doing a workshop specifically for caregivers for people with dementia and memory loss. And we're using one of our dementia consultants, one of our subject matter experts in our community to deliver that workshop, who is a consultant. So it's something that came out of a really unique opportunity here in Kitsap County through our 0.1% mental health, substance abuse, and therapeutic court funding. It's local tax dollar funding. And actually the chair of our 1/10 Mental Health Advisory Council is here with us as well, Charmaine Scott. She just kind of raised her hand. So we applied for funding to launch kind of a dementia partners in memory care is what we called it. About 5 years ago, we used our local tax dollars through mental health kind of verbiage around caregiver stress to individuals with memory loss and dementia to receive some local dollars to then create a consultant kind of subcontract. And we also discovered we don't have an Alzheimer's Association chapter here in Kitsap County. So we worked with the King County chapter to come across the water and work with us. We work with the local Bainbridge Island Museum to create a docent day, which is still up and running. We had restaurants that did dementia, specific dementia days for family members, like those cafes, to come in and really feel comfortable in our community. With COVID, some of those services have come and gone. And I guess the lesson here is when you know what your community needs, you need to be flexible and adaptive to move into those opportunities. And when those opportunities present themselves, and then know when one door closes, hopefully a window opens, right? Because we know we're making headway, but sometimes it feels like one step forward, one step back. And so I think collectively, this is where our advocacy is so incredibly important, because we're able to share great ideas and then also amplify our message about why it's so important to support these services. So I just wanted to share kind of that hindsight, how we've worked with opportunities through the years, kind of like Lori Brown shared with Southeast Washington. There's times and opportunities that things present themselves, and you just kind of have to be ready to go with it and be comfortable with being uncomfortable, right? Just taking that risk, knowing your community is going to be better served if you do something, and then you learn from that and you take the next step forward.
Thanks, Stacy. I had a couple different directions I wanted to go possibly. I want to talk a little bit about, us being a dementia-friendly state and what that's going to mean and how that all that age-friendly and dementia-friendly gets factored into the multi-sector plan and ideas you have around that. But also, I just wanted to ask, this is a little bit of a dilemma I find for myself. So, it's really important to do all we can to prevent a disease. We all know that. And, a big focus for the Alzheimer's Association has been research to find a cure, a drug, something so that we have fewer people living with dementia. At the same time, we want to demonstrate our respect and want to help people maintain their dignity as long as possible if they're living with dementia. And do you ever find a little bit of a conflict of like, on the one hand, I'm saying, well, here's the things you ought to be doing so you don't get it. And that the potential for people to say, well, maybe you should have done these things. I just find myself balancing those two because I think they're both very important ways to support people around dementia. If you have any good ideas, because I do find myself sometimes a little caught in the middle there.
So I always kind of frame dementia science as where we were about 20 years ago with Alzheimer's, or not, I'm sorry, with the autistic spectrum disorder, right? Like brain health is such a new science and we're learning every day. So I always say it's what we know going forward that's going to help us. It's not shaming what we didn't know, right?
Right.
It's every day is a new day, a new opportunity, a new start to do something different to promote our brain health and our longevity. That's how I approach it.
That sounds good. Eileen?
So this isn't well thought through. I just want to say that up front. But in terms of, our whole battle with physical health and mental health, it's like I wanted to just jump in and say, more and more has been discovered about the physical problem of cancer and what you need to do to avoid it. And yet, at the same time, we don't not serve people who have lung cancer, who have colon cancer because they weren't eating roughage, or, it's just like people try to do the best they can, but it doesn't mean that we don't have compassion and plans to help people do as well as they can if they have a disease, whether that's a physical disease or a brain disease. Anyway, that's just my blah.
I think you're right. That's a very important thing to keep in mind. So can we talk a little bit about dementia-friendly state and the multi-sector plan? I want you to be able to talk about whatever you want to talk about. So if there's other topics, or something else, you have a question that you want to bring up to the group, and then we could move on to that next topic. Nothing burning that you gotta, okay. Well, so this is confusing. All right, so the governor and are at the state agency level applied. So we have applied to be an age-friendly state, which is through AARP. And so AARP has principles and processes and things that either, the community, or in this case, the state, is going to be doing to move in the direction of, being able to say we're an age-friendly state. The dementia-friendly is through US Aging. So they come out of like two different national organizations, but I'm sure very much overlapping in their perspectives. And I'm not personally well versed on all the aspects of, what a dementia-friendly state is. Or dementia-friendly community. Some of you who are living in a designated dementia-friendly community have a better idea of what that means. I think I have an idea, but also I'm trying, if we're in the process of doing all that work, and also the state is pursuing this multi-sector plan, which is, as B said, it's broader than what the area agencies on aging do for their 4-year plan. Although I'm not sure I totally agree with that, because I think that when you all are looking at your community and serving the needs of older adults in the community, that's a pretty broad perspective. You may not have control over a lot of the things like housing, but it doesn't mean the AAAs aren't identifying that in your planning process. But to whatever extent, I do know the multi-sector plan, there's a lot of talk about we're trying to bring in all kinds of perspectives, and often we don't do a lot to bring in the private sector and businesses. And I know that's true, though in an age-friendly and dementia-friendly community, you do that, right? That's part of, you're reaching out, just the things you've described. You're a lot of times educating your business community and just getting people more comfortable with understanding how to interact and support individuals with dementia. So do you have any thoughts or things you would want to make sure as the state, because it is being driven at the state level, and they have an advisory group, and they're talking about, well, who all do we bring in to this conversation, and how do we do these community listening sessions, and would there be certain things you'd really want attention paid to if we're really looking at bringing in the perspective of dementia friendly? I mean, maybe we're doing it now. Maybe all the things you're doing now and making sure we tap into that. Aruna? Oh, your sound's off.
Financial fraud is very common, especially with cognitive impairment and dementia, and judgment as far as managing the finances is executive functioning, and that goes also along with memory issues and planning and all that. So I think having the banking sector to be part of it, so that there could be some education proactively for the communities, so the people in their 50s, 45, 50-year-olds are listening about what kind of things can happen and how to be aware of it. And also the adult sons and daughters of their parents also could be learning about it, so they can kind of prevent their parents or loved ones becoming victims of financial fraud. So banking sector would be important, and businesses in general.
Right.
I don't know, that's what I think.
Well, when you're talking, what you're reminding me is the days of the gatekeeper program that was so popular, 30, 40 years ago, and may have even originated out in the Spokane area, I think. But it's that concept of all of the people in the community who could be coming in and intersecting or interacting with individuals who it's not, maybe they have physical disabilities, but there are people, we're thinking in this case of folks with cognitive challenges. So yes, banks, even people who are like, they had meter, you don't do meter reading anymore, do you? Everything's changed so much. I don't know who has eyes. Well, we just talked about our Meals on Wheels and the home delivered meals. I mean, there's a lot of different places where you want to make sure you have folks who are trained enough to know, what to see, what to say, how to help. Because if you truly had a dementia-friendly community, that's what it would be, right? People would be looking out for other people. If you saw somebody having issues, you'd be trying to help them, or, help them get the resources they need. Dementia-friendly businesses, you're right. I mean, it's sort of like age-friendly businesses. When I was in the city of Seattle, there were one of the things they were doing through the age-friendly initiative was having businesses could have a little sticker on their window when people would come in saying, I'm an age-friendly business. And, I'm sure there were criteria associated with that. Oh, it looks like we're coming. Hey, Rebecca. Are we done or are you just joining us?
I wasn't sure if you got my message that I sent from the main room, just that we had 5 minutes left. So I was just checking in to
Oh,
try.
I'm glad you did that because I did not get the message. I usually it comes up and says your session's going to end within a certain period of time. So
Yeah, so I'm just gonna pop into all the rooms and let folks
thank
know.
you. Okay,
So
so
now we
we are
have
going.
3 minutes left.
Okay, thank you. I appreciate it. All right, with those 3 minutes, any last thoughts you want to share? What is there something you want W4A to be doing at our level? We are certainly again, I said our primary initiative these days is the Dementia Resource Catalyst services, trying to get those in every area agency on aging because we are seeing where they're having such a positive impact, and doing that in conjunction with the Dementia Action Collaborative. Are there other things you would like to see from a state level?
I don't know if this fits in here because of aging, but right now there is this big trending of cancer cases in men in their 30s to 40s. The most common treatments for these cancers, radiation and the type of chemotherapy they use, lead to cognitive impairments.
Oh boy.
I ran into that when I was 43. I'm 67 now, and some of the cognitive impairments that I see in the Dementia Friends Handbook are things I've been living with since I was, went through the chemo and radiation. So there's going to be a big wave of younger people hitting with dementias eventually, and it might just be something to, you know, in a way, it's sort of ageism just to direct it all at aging too.
Yeah.
It should be for everybody, but I do understand that so much money is allotted to aging, so it must go that way.
Yeah, that's a good point. So we do know we're going to see a rise in the population because of the aging of the population. We've talked about that for a long time. We do see dementia and higher incidence as people get older. They say if you live to be, what is it? You live to be 85, 1 in 3. Isn't that what they say, have some kind of cognitive challenges? Which is a big percentage, big percentage of us. But you're right. There can be reasons why people are affected at a younger age too. So anything we do that benefits our communities and better supporting people with dementia, regardless of their age. And when we run out of time, but I would just say I spent a lot of years working in the disability world, and for people with cognitive disabilities, there's a lot of similarities in terms of, being a welcoming community and trying to help people feel a part of the community. A lot of the things you do are similar. So that would benefit, that gets at the whole age friendly, disability friendly, dementia friendly world we'd probably all like to see. Any last words? I think we're running out of time. You can have the last word if you want. Well, I think we're leaving the breakout room. It looks like it gives you that option. We're closing 5, 4, 3.